So I work at Good Samaritan Hospital and MultiCare. I am a sterile processing technician, and I'm also the vice president of SEIU 1199 Northwest. Um, so people ask, I always get, so what is sterile processing in the healthcare field? And so what we do is basically process equipment or instrumentation that is used in the OR, right? And so, and we also set up the cases. Everything that you use in your surgery, for your surgery, is what we put up, set up in your room. So that is what I do. And then the other part is my my vice president for the union. I represent over 33,000 healthcare workers throughout the state. So I guess you could say I'm an advocate or a representative for healthcare workers from all job classes in the healthcare field. Yeah. In the beginning, it was very chaotic, I guess you could say, most anywhere, right? Because it was just something that no one has ever dealt with. And for us in the hospital setting, in the hospitals as healthcare workers, I would say more scary because we're having to deal with the patients now that are coming in thinking they may have COVID, and then waiting to see if they are COVID patients, and then having them admitted to the floors and who's going to take care of them, right? So a lot of fear factors there at the beginning because we didn't know what we were dealing with. And at the time too, we didn't have enough PPEs or protective gear, adequate protective gear. So it affected us in the fact that we weren't prepared. Also, I work closely with the OR, so it affected us tremendously because there were no more elective surgeries, right? It was just emergent surgery. So that cut back a lot from what used to be a normal average 35, 40 cases a day, went down to maybe 4, 5, and that was emergent cases. So from my department in sterile, we were able to, because we were already short-staffed to begin with, which is, you know, a issue all over. But so we were able to keep our jobs, but the OR staff, they had to take a lot of low census rotating, but we were able to, through some temporary bargaining, we were able to get them compensated, and they didn't have to dip into their vacation time or PTO. When you have 3 powerful unions, you have healthcare unions, right? You have WSNA, the nurse union. You have SEIU, which encompasses all healthcare workers, and you have UFCW, another union encompassing all healthcare workers. All 3 of us got together, all 3 unions got together and bargained with the employers a temporary contract, I guess you could say, for our healthcare workers. And in it, we addressed compensation, you know? So for instance, I was talking about the folks who had to take low census. Instead of having them take low census and go home and use up their PTO, let's try and be innovative and move them around to where they maybe can just answer phone calls or direct calls to other departments. And so we were able to negotiate that. So having to take low census was an option eventually, and if they chose to, we could move them in, put them in a float pool, and we could move them within the hospital or then within the system. the health system. So maybe say one person who worked at Good Sam, we couldn't accommodate them in any way within Good Sam, then they could go on to Auburn. Maybe there was a position in Auburn that they could do instead of having to go home. So we were able to bargain that. We're also able to bargain compensation for certain job classes like RT, respiratory therapists, certain technicians, RNs, CNAs, those that have direct patient care. We were able to bargain, I guess you want to call it hazard pay. We call it full pay or premium pay for them. And training for like for our housekeepers. Some people forget about them, right? But they're very important to the prevention of the pandemic spreading. They're the ones that have to clean the rooms. And so it's important for us to make sure that all our healthcare workers got the proper training to address to the COVID. Many respiratory techs right there face to face with these COVID patients, right? And even though they have the N95s and they're all in their PPEs, but they are frontline and they're dealing with this every day with the possibility that they can take it home to their families, right? And so I think it's really important for some of these job classes where they have direct patient contact. Just do your part, follow the mandated guidelines, just follow social distancing. The employer's accountable, checking in with the employers some way, somehow, and making sure that employers are getting the proper PPEs to their employees. If you want your employees to work during these times, then provide them with the proper PPEs. We need legislation, and I hope they create some kind of introduce bills related to COVID for workers. It means to me that I go to work and I feel comfortable doing my job. I feel comfortable that I can come home. I didn't in the beginning, but I feel that I could feel comfortable coming back home and I not spreading this to my family members, my friends. In the beginning, very leery, like everybody else, we don't know what this is. And I have elderly mom, and um, so that's what for me feeling safe is regarding work. Health wise, yeah, you know, um, I do my part, social distancing, I do my masking, and I try to avoid going out unless I really need to. And as long as I do my part and I feel that, okay, I'm okay. So